So again, it's understanding your prescription drug coverage, how to get the meds you need. I am Sarah Bramblett. I'm the OAC Senior Advocacy Manager. Tonight's agenda, we're just get a brief introduction, going over understanding your prescription drug coverage and how to get the medications that you need. We'll also go over the appeals that are available to you, share some additional resources, and we will have a question and answer period. And I've already introduced myself, Sarah Bramblett, Senior Advocacy Manager. I'm a patient living with obesity. I am also a policy expert at this point from navigating the healthcare system for myself. And then I've now moved on to helping others understand the process. And I have had to do many appeals, both for regular medical treatments and for prescription medications. And I've been successful in getting those appeals. So, understanding your prescription drug coverage. First, it's good to understand where your coverage comes from. So, as with medical insurance, there's different types of insurance. It can be from your employer. When it comes to employer plans, there's two different types of plans. There's a fully funded plan and a self-funded plan. So, fully funded plans is when the insurance companies pays for the cost. A self-funded plan is when your employer pays for the cost directly. The reason knowing the difference between what type of insurance you have through your employer, because it does directly affect the types of appeals you have and also the power you have in getting coverage decisions changed. So when you're a self-funded plan, the employer has more ability to dictate what is covered and what is not covered. So you're more successful when you go to your human resources or administration and advocate for yourself and your other coworkers in getting the coverage that you need. And fully funded plans, those are typically ones that we would recommend, like going to the state insurance commissioner regarding any types of appeals or coverage issues. So it's good to know which of those types of plans you have if you have an employer plan. Then, of course, you have the ACA marketplace plans. These are the healthcare.gov or state exchanges. ACA stands for Affordable Care Act. Then you could also be a state or a federal employee, and especially in federal employees, there are several different plans that are available. Medicaid is, of course, the state-run program for low-income individuals. And then Medicare is for individuals 65 or over, or individuals with certain disabilities who are under 65. Then, of course, there's military insurance, which is either TRICARE or the Veterans Administration. So this is where your not just your healthcare insurance, but also your prescription drug coverage comes from. And then how prescription coverage works. Sometimes it's a different health plan than your regular medical insurance. And so it can be handled separately. I can't tell you how many times I've been at the pharmacy and seen someone trying to pick up their prescription and not having their prescription drug card. They have their regular insurance card, and that's not what they needed. And they're trying to call their spouse or call someone and get that information so that they can get their prescription picked up. So it's good to know what is your prescription plan. Is it a separate plan? Is it the same and on the same card as your medical plan? When it is separate, you will often have a separate deductible to meet for your prescriptions. So that's another thing to know and keep in mind. A deductible, of course, is that minimum that you have to pay out of pocket before your benefits fully kick in. Preferred pharmacies sometimes might be considered in-network pharmacies. So these are the pharmacies that your insurance will want you to use to get the best price. And then, of course, mail order. You might be able to save money and get a 90-day supply by mail order. Sometimes you can also get a 90-day supply through your local pharmacy. Sometimes that is also a benefit that so you can go locally. It doesn't have to be mail order. That is a way, especially for medications for which you're on for chronic conditions, such as obesity. I know there was a few times I've been able to get my obesity medications on the 90-day supply several years ago before any of the shortages happened. I have not in the past, probably more than a year, been able to get that. Um, but it is something to consider I do know some friends who are on obesity medications, and they do use mail order for theirs because it's the lowest, and they are in a different state, different area than me. So, but it is certainly an option even for these medications. So what you will pay, it's good to understand the cost. Again, so you can plan out your care. Deductible, again, as I mentioned, is the amount you pay before your plan starts to cover your medications. It can range a lot. So that's certainly a number that you need to know. We're into May, so most people, I'm sorry, we're into June now, we're past May. So most people probably have met their deductible. If you haven't, you might only have a little bit left. I know in January and February, that is a big amount for a lot of people to manage. So, but it's something you definitely want to know what is for your plan and be prepared to be able to pay out of pocket that amount. Actually, I say in January, some plans do start over in July, like it can range. So maybe you are coming up on the renewal of your plan year. And so maybe in July, that deductible will need to be met. Copay is a fixed amount for each prescription. So many times it's like a 15 or $20 copay for the month. And then coinsurance is a prescription percentage. So sometimes it's 20/80 with a lot of plans, as is with the healthcare. But it's good to know what that amount is going to be. Copays are kind of nice because it's fixed and you know what's going to be, or coinsurance. It could change on you because unfortunately the price of the medication sometimes do change. We're not really certain. Not just speaking of obesity medicines, but in general, I know the price of I've had different medications cost different things. So it is um, interesting um, situation. And so sometimes copays are nice, but we really don't have the option to pick that when we have insurance. It just comes with um, plan we get. So tiers and formularies. So the plan does get to decide which medications are covered and how much. So tiers, medications are grouped into tier levels. I know if you hear commercials a lot, they say like tier one and tier two have like a lower copay or a low out of pocket. Those are usually like a generic um, lower cost medications. And then you get up to a tier three and a tier four. Those are the more expensive, but a lot of um, the plan gets to decide how they tier a medication. So sometimes you do find more of what you use being like a tier three. Sometimes more specialty medicines are the tier fours. And the formulary refers to the list of covered drugs. So if your medication isn't on that list, their formulary, you might need to ask for an exception. We are going to discuss that later when we talk about appeals. So getting the medications you need, sometimes it'll take extra steps to get your medication covered, but it is doable. And we have seen with obesity medications, it is lots of extra steps sometimes. So we wanted to kind of go over some of the things you might hear about. So medical necessity, your doctor might need to explain why you need the medicine that is essential for you. And then I did want to point out the other FDA indications for current obesity medications. So Wegovy is also approved for cardiac risk reduction, and Zepbound is approved for obstructive sleep apnea. So if you have um, either of those, so the cardiac risk reduction is if you are patients with obesity who have had a prior cardiac event. So, an examples would be a heart attack or a stroke. And for obstructive sleep apnea, it's for moderate to severe obstructive sleep apnea. But those are other indications that the FDA has approved. And Medicare has also indicated that Medicare can cover these. I apologize to take a step back. So the reason insurances are able to deny coverage for obesity medications is because Medicare currently does not cover obesity medications. When Medicare Part D was put into place, there is language that states they do not cover any medications for weight loss. Now, we all know that obesity medications are for more than just weight loss, they are for the management and treatment of a chronic disease of obesity. We are working on getting that overturned, as you're aware, with the Treat and Reduce Obesity Act and with working directly with CMS we have been advocating for years to change that language or to get the coverage. Um, as does Medicare, the other plans follow. So once we get that, I mean, we're working on getting it fixed through many states and through many plans. But to get it fixed at that top level with Medicare would help get the coverage for other plans to follow. So while Medicare doesn't cover um, medications for obesity, they do cover medications for cardiac risk reduction. They do cover medications for obstructive sleep apnea. So if you have these other indications, you should have a better chance at getting um, these medications covered, even if you have another type of insurance, because again, those insurance should be covering the Medicare guidelines. So if Medicare is stating that these medications can be covered for these other indications, then private insurance, Medicaids, and ACA plans should be covering for these other indications also. Again, it might take a little bit of extra work, and this is why we're here tonight to give you this information so that you can advocate for yourself to get what you need. Step therapy. Sometimes they might want you to try a lower cost medication before you can try a next one. So this is currently happening in the obesity space also. So just be aware that might be a requirement that you need to try another medication for several months or a certain time period to see if you're how you do on that medication. And then your insurance should provide what the process is of, what the criteria is if you are able to, if the medication is effective for you, if it's not effective for you, what documentation your doctor needs to move on to get other medications that will work for you. Prior authorization, this is really pretty common, especially in the obesity space. Your doctor just has to get permission from the insurance before the medication is covered. So it is something that usually if you send a prescription in, the pharmacy will let your doctor know that they need prior authorization. They'll send a form back to your doctor electronically usually, and the doctor completes some questions or several questions and sends it on back to the insurance company. Sometimes it takes some follow-up between the pharmacy and yourself and the doctor's office to see if that got back in and got processed. I know I have to do that often. I find out, I get a call from my insurance company saying they approved it, and then I have to call the pharmacy and ask them to run it again because the approval came in. It's unfortunate that we have to do these extra steps, but at least there are ways for us to get covered what we need. Um, Quantity or duration limits. So some medications might have limits. They might only be approved for a short period of time, or you might need to have reapproval every 6 months. This is another thing we're seeing where maybe after 6 months you have to show that you've made so much progress with the medications. And then medication switching, or sometimes it's called the therapeutic exchange, where they might want you to switch to a drug that is similar but costs less than your current one. So I wanted to add this in. There are some ways to get help with high drug costs, because even with coverage, sometimes you might have that high deductible, you might still have a high out-of-pocket copay or a high co-insurance. So I wanted to mention that there are manufacturer discount programs. You can visit either of the manufacturer's websites, and they have information on their discount programs, their coupons, saving cards, or cash pay options. You might also want to check pharmacy discount cards like GoodRx, and they might offer some coupon codes for that. And then I did want to mention this because I mentioned how Medicare does cover uh, Wegovy and Zepbound. And I know we heard from several patients that even with that coverage that started, that their co-insurance and their Part D plan was still quite high, like still $600 or $700. And for someone on Social Security, disability, or retirement, that's still a high price. So in 2025, there's now a max out-of-pocket cap for Medicare Part D plans, and it's $2,000. So that is the most they're going to pay for all their medication in the year 2025. Once they've met that cap, everything's paid at 100%. Now that still can be quite expensive if you have to, pay that $600 or $700 right out of pocket to pick up that prescription. So some Part D plans actually do offer some payment plans. So if you are a Medicare recipient or Part D, or have Medicare Part D plan recipient, check with your plan. They might be able to pay a smaller amount each month to pay off that $2,000 for the year. And again, OAC is advocating to get better accessibility, better coverage, and better affordability for medications. So, in case you are not approved for your medication gets denied, you can and should file an appeal. If you don't file appeal, the answer is going to continue to be no. If you do file appeal, you at least have a chance of getting a yes. At the end of this, I'm going to share the link to my previous webinar regarding appeals and how to file appeal and why you should file an appeal. And in that, I provide the information how there's a high percentage of people who are successful when they file an appeal. We just have to continue to ask for what we want and advocate for what we need. So if you do file appeal or when you do file an appeal, these are the documents that you should have that strengthen your case. So again, a letter of medical necessity from your doctor. Sometimes you need a list of medications to show what you've tried and what didn't work, especially if you are required to do any type of step therapy, um, or if there's issues with the tiered medicines or the formularies, you definitely want to show what you've already tried. Any test or clinical notes that support your diagnosis and treatment history. This is especially important if you're going with the other indications of cardiac risk reduction or obstructive sleep apnea. It's good to include the FDA approval labeling and clinical guidelines. This is what the, the FDA labeling and the manufacturer's clinical guidelines should be what is being used to say if you need the medication. Insurance companies might set their own guidelines, but we should really be going and pushing for what the FDA approved or the clinical guidelines are. And then any published research or case studies that show the medication's effectiveness for what you need it for. I know this sounds very overwhelming. It kind of rolls off my tongue because I've thought so much for myself. But again, that's why I wanted to put it together to share with everyone. Work with your providers, your healthcare professionals to submit this information. You don't have to do it alone. Um, I I know my medical professionals and my providers don't get paid extra to help with this. Now, I think several of them are very used to doing it and they want to make sure they help their patients. So they're a little bit well versed in some of the common things like the prior authorizations and such. So they are well versed in this. Once you do have like a letter of medical necessity things, you can keep, that access to then send if you need to send it again. But don't feel like you have to submit everything. Your provider should have the information. You might need to pull some information from if you see other providers, like say, for example, you have a obstructive sleep apnea and you've seen a pulmonologist for that, maybe you need to get the records for them to support that and send it in. It might be something your primary care can also pull because with electronic medical records today, we should be able to talk to each other and get those records. I am the type that I like to pull records and save them myself so that I have everything ready and that I know things are getting submitted when they need to be submitted. So now we come to some of the wording and what's the language I wanted to bring to people's attention so they know what to ask for. So the first one is a tier exception. And so again, as we mentioned earlier in the presentation, the insurance plans group medications into tiers and like price levels. So the lower cost tiers are usually the generic lowest cost tier one. Tier two and three are brand name drugs, more expensive. And then tier four are the higher specialty drugs. So a lot of what we are discussing for treatment of obesity is going to be like tier two or three. And there are several medications on the market. There are actually oral medications and injectables. I think there's a lot more than people realize because there's just some that have been in the news more and are more effective. But there are several. So you might, again, be told you have to try some other ones before, um, a step therapy before you can get the one your doctor prescribes, or they might only cover certain ones. So if your doctor prescribes a medication that's in a higher tier, but it's the only one that's the best option for you, you could always ask for a tier exception. And the reason would be so that you can get that pay less for it or closer to what you're paying in other tiers. It's certainly something you can ask for. I believe this is something that a lot of federal employees recently have done. I'm not sure exactly what in the area, but I know it was on the radar of needing to do it because of changes some of the federal insurances changed at the beginning of this year. So there was some tier exceptions that were being asked for and approved. And then the next one is the formulary exception. There was a lot of news recently about a major insurer changing their preferred or changing their formulary and having a preferred medication on it. So we wanted to, just provide this for everyone because it's not just one insurance that does that. A lot of insurance does that, and this is also very common for some other medications. This is the first time a lot of we have enough obesity medications now. That's the first time that's really hitting our community. So it's good to know how to navigate it. So it's called a formulary exception. It's when, since your insurance has a formulary and lists of drugs are covered, this is when the medication that your doctor wants you to take isn't on that list. So it wouldn't be covered at all. But if your doctor believes this is the medication that's necessary for you, you can request a formulary exception. And that way you would get the medication covered by your insurance, even though it's not typically covered. Um, and going back to the documentation portion, some of these examples would be if you tried another drug and you weren't able to tolerate it. And so this is why you need the medication that your doctor is prescribing. So that would be a reason that you need an exception and hopefully to get it approved. So that type of information of like, I tried the medication that's preferred. It doesn't work for me for various reasons. I can't tolerate it. I'm having side effects. Especially if you have one of those other indications like sleep apnea or um, cardiac, past cardiac event. Is there a medication on the formulary that actually covers for that indication? So certainly you can ask for there to be an exception to their formulary list and just provide that documentation, the clinical notes, the medical necessity of why you need the medication that the doctor is prescribing for you. So here are some additional resources. We have our website for the access to care resources, and I can send these links out after the presentation. And then we also have, as I mentioned, a link to the Appeals 101 webinar. And I'll just wait on this page to give people time to scan those if you have your phone out or. And then next is our action center thing. So currently we do have an affordability sign-on letter. So if you wanted to sign on to that, the letter is addressed to lawmakers, insurance companies, pharmacy benefits managers, and employers, all who are responsible for providing affordable and accessible medications for our population. So you can scan that, and it's a letter addressed to all of them, and you can sign your name onto that. And then we also just have our main OAC Action Center. There's currently actions up into the current administration to address coverage for obesity medications. And there's also several state actions now where we are working on state Medicaid coverage, state um, employee coverage, um, there's some states where it's just a um, mandate for private insurance, large group private insurance to cover comprehensive obesity care. We do advocate for all treatments, um, but one of the common one now is for medications not being covered. But when we do advocate, our goal is to have access, access to comprehensive obesity care, which includes medical, surgical, pharmaceutical, um, uh, and of course the when I mentioned medical, that includes the intensive behavioral therapy, nutrition, dietetics, mental health. Um, it's for every aspect of treatment. We need patients to have access to every tool in the toolkit, and providers being able to prescribe that for their patients, and the decision for treatment to be between the patients and their doctors and medical professionals, not legislatures. So these are the um, ways to get involved and help advocate for improved access to care.